How are you?
Good. All right, so I want to look a little bit at your strength today and your arms and legs. I want to spend the most of our time looking at your balance and your mobility, how you get around.
Okay.
Does that sound okay?
Yep.
One of the big benefits I know for my students was being able to see individuals in what we call the chronic phase of stroke recovery, which is a very different phase than what we often see on their clinicals, which is immediately post-stroke, or the acute phase.
Relax. All right, hold right there.
And so each of them did the physical therapy component for one of the clients. So they then had to have an initial plan for how they were going to evaluate each individual's mobility and balance, etc. But then they had to adjust it based on what each person's presentation was, based on whether they were able to stand or not stand, for example.
All right, that was perfect. Thank you very much.
The students were required to sort of alter their plans on their feet, which is a great practice for real clinical care.
All right, we're going to do the same thing sideways.
Going this way?
You got it.
Look up.
Yeah.
Look down. And up. Very good.
Ready? Go.
And I do think the fact that having nursing and social work and other disciplines there who look a lot more closely at things like quality of life and psychosocial aspects of care allowed them to maybe see things they might not see if it was just physical therapy alone.
Ready? Close. I'll tell you when to open.
The students commented that for them, they learned, I think, many aspects that they didn't get to see when they were out in their normal clinical rotations. Especially as well the fact that the spouses were there and they were able to get a sense of the effect that stroke has on the family as a whole, beyond the patient themselves.
Okay. Have you fallen within the last 6 months?
No.
No. Okay. How about the last year?
Yeah.
Once? Okay.
Yeah.
Okay. And was your stroke, which side are you mostly affected on?
Yeah.
Okay, that's what I was noticing. Good.
I would absolutely recommend it for students. It would be great if we could figure out a way to scale it up a little more so we could involve more students, but I definitely think it was a beneficial experience.